Hello there and welcome back to the Medical Minutes. Today's video is going to be part of my Eliminate Low Back Pain series, but it's going to be from a different approach. We're going to look at some alternative approaches such as like nutrition and movement patterns and things of that nature. So it's going to be a good one. If you watch the previous two, there'll be some new content other than that. So if you're already doing that stuff and it's providing some relief, start integrating this new information and hopefully we get you there to perfectly pain-free. All right, so the two things I really want to get into in this video are going to be managing low back pain from a nutritional and movement perspective, okay? So hopefully you've watched the other two videos. Hopefully you're already beginning the therapeutic modality type approach with the heating and maybe some topical analgesics or something. Hopefully you're doing some of the planks, the side planks, the glute bridges, the anti-rotation exercises from a rehab perspective. But now we're going to speak first on weight management. So weight management is coming from the idea that when you are heavier in body mass, you put more compression on the spine. Compression on the spine leads to pressure on the ligaments, the cartilage, the muscles, etc. Okay? So my first go-to is always try to develop a window for eating, okay? Eating hours, if you will. So what I like to say first would be like 11 to 7, 10 to 6, as that's my recommendation of the hours. And I say that because it introduces a little bit of like an intermittent fasting idea. I'm really not into promoting fad dieting and stuff like that, but intermittent fasting is an interesting one. And what it does is it prolongs the period from sleeping, right? So when you sleep, you're sleeping hopefully for 7 to 9 hours, which is the recommended amount. But if you're sleeping for 7 to 9 hours and then you're able to add another 3 to 4, 2 to 3 hours before you're eating, you're getting a good 10 to 11 hour fast in there. And that's having your body then really have to utilize the nutrition from the food you're ingesting. Okay, it's not going to store it. It wants to use the food as fuel so you have more energy throughout the day. And on the back end, I like to say try not to eat much or a big meal about 2 to 3 hours before you go to sleep, because when you sleep, your body enters a state of restfulness, and anything that goes in there and being digested at that point it can give you trouble sleeping, first off, and second off, it's more likely to be stored as adipose tissue and things of that nature. Okay, so first things first, develop an eating window, eating hours. Next thing is food choice. So a lot of antioxidants, anti-inflammatory foods are my recommendation. Blueberries, colorful fruits, colorful vegetables, things that are rich in color usually are rich in vitamins and minerals and antioxidants and things like that. And then on the flip side, avoid inflammatory foods. So avoid fast food, avoid kind of processed white carbohydrates that really aren't providing much nutritional value. If you take these three things into consideration, you should be in a better place to manage your weight. The second point I'd like to make, and I'm not going to get too deep into this, maybe in another video, is going to be from the movement perspective. So when I'm here, I try to move around every hour or so, and thankfully I have a job that requires me to move quite a bit. So I'm up and down, and I try not to sit too often. But if you do have a place of employment or you're in school and you have to sit for a long period of time, force yourself to get up and move around every 45 minutes or so, or once per hour for roughly 10 to 15 minutes. Hopefully you get a lunch break and you can kind of develop a little bit longer routine where you can then add in some stretching, maybe some soft tissue mobilization like foam rolling or massage gun. A lot of percussive therapy is popular nowadays, and they're really small and compact. You can keep them in a briefcase or a backpack. So if you can incorporate movement along with nutritional changes, I think this is going to be another key to put into your low back pain elimination routine. Okay, so thank you for watching. This has been a little bit lengthy video, but if you enjoy these, please comment, like, subscribe. And definitely give me suggestions. I'm going to try and keep thinking of ideas to add to this playlist, because this will be the one-stop shop for you guys to go from pain in your low back to pain-free. And I'm going to do my best to help you out with that. So thank you for tuning in. I'll see you guys in the next one.